The 18-year-old prisoner is hyperventilating on the examination table, his hands gripping the metal edges so hard his knuckles are entirely white. For 3 agonizing weeks, he has hidden a massive shrapnel wound beneath a filthy, makeshift bandage, terrified that exposing it would mean an instant execution. As the medic uses heavy shears to peel back the stiff, blood-soaked fabric, a sickening layer of black and green tissue is revealed, weeping dark fluid down the boy's thigh. The teenager takes one look at his rotting leg and completely breaks down, sobbing hysterically and begging the guards not to saw his limb off. The American doctor steps forward with a glass syringe, preparing to shock the brainwashed boy with a treatment he never thought he would live to see. The scene begins on a sweltering afternoon at a massive United States prisoner of war intake camp. Thousands of captured German soldiers are shuffling through the dusty gates, exhausted and hollow-eyed after surviving the long, brutal transport across the Atlantic Ocean. The American guards are processing the men as quickly as possible, sorting them into lines for delousing, registration, and mandatory medical inspections. Amid the sea of defeated men, an 18-year-old boy named Judel is trying desperately to blend into the middle of his group. He is sweating profusely despite the cool breeze, and every time he steps forward on his right leg, a sharp tremor runs completely up his spine. Judel is using every ounce of his remaining willpower to mask a severe limp, shifting his weight awkwardly to avoid putting pressure on his thigh. He knows the guards are watching the lines closely, looking for men who are too weak or sick to join the general camp population. In his terrified mind, being pulled out of the line for a medical problem is the equivalent of a death sentence. The state-sponsored propaganda he consumed in Germany convinced him that the Americans routinely executed wounded prisoners or amputated their limbs simply to avoid treating them. He clenches his jaw, staring at the boots of the man in front of him, praying that he can make it to a dark barracks bed before his leg completely gives out. We are currently at the intake gates of a United States prisoner of war camp, watching a terrified boy hide a life-threatening injury. Now we will see how the sharp eyes of an American medic shatter his desperate illusion. Despite his best efforts to walk normally, Judel cannot hide the biological reality of what is happening underneath his uniform. A senior American medical officer is walking up and down the intake line, visually screening the incoming prisoners for contagious diseases like typhus or tuberculosis. As the medic passes Judel, he stops abruptly, his nose catching a distinct, sickeningly sweet odor that cuts right through the general smell of unwashed bodies. It is the unmistakable scent of necrotic tissue, a smell that every experienced combat doctor immediately recognizes as advanced gangrene. The medic turns around, his eyes locking onto the pale, shivering teenager who is desperately trying to stand perfectly straight. The medic does not ask questions, simply gesturing for 2 military police guards to pull the boy out of the formation. Judel panics immediately, trying to step backward into the crowd, but his injured leg finally buckles under the sudden movement, sending him crashing to the dirt. The guards catch him by the arms, dragging him toward the bright white canvas of the camp hospital tent while he thrashes in absolute terror. He is completely convinced that his secret has been discovered and that he is being dragged away to face the surgical saw. We are in the middle of a chaotic intake yard as a hidden infection is finally intercepted by the medical staff. Now we must go back 3 weeks to a shattered forest in Europe to see exactly how this terrible wound was born. Let us know in the comments where you are watching this from. Are you in the United States, Germany, the United Kingdom, or somewhere else? If you want to dive even deeper into these untold stories, consider becoming a channel member. You'll get your name mentioned in the video, early access to videos, exclusive content, and direct input on which stories we cover next. Join our inner circle of history keepers. 3 weeks before arriving in the United States, Judel was a frightened infantryman defending a collapsing position in a dense German forest. The Allied artillery barrage had been falling for hours, turning the ancient trees into deadly wooden shrapnel that rained down on the shallow trenches. During a frantic attempt to retreat to a secondary bunker, a heavy mortar shell detonated just a few yards away from his position. A jagged piece of hot steel sliced cleanly through the thick wool of his trousers, burying itself deep into the muscle of his outer thigh. The impact knocked him flat onto his back, leaving him gasping for air as a warm, heavy rush of blood immediately soaked his leg. The chaos of the retreat meant there was absolutely no time to call for a field medic or seek proper medical evacuation. Judel dragged himself behind a shattered oak tree, his hands shaking violently as he assessed the massive, gaping hole in his thigh. The metal fragment had exited cleanly, but it left behind a deep tunnel of torn muscle, dirt, and shredded uniform fabric. The adrenaline flooding his system temporarily masked the blinding pain, allowing him to focus entirely on stopping the rapid blood loss before he bled out in the mud. We are in a freezing, artillery-scarred forest watching a teenager desperately try to save his own life. Next, we will see how his frantic attempt at first aid sets the stage for a massive, rotting infection. With the artillery barrage creeping closer, Judel knew he had to bind the wound immediately if he wanted to keep running with his unit. He ripped a long, filthy strip of cotton from the bottom of his undershirt, a piece of fabric that had not been washed in over a month. He packed the torn cloth tightly against the bleeding crater, wrapping it securely around his thigh to create heavy pressure. The improvised tourniquet successfully stopped the major bleeding, but it also trapped a massive amount of forest dirt, sweat, and bacteria deep inside the open muscle tissue. He tied the knot as tightly as he could, pulled his ruined trousers back over the bandage, and staggered after his retreating comrades. For the next 2 days, Judel limped through the freezing woods, completely unable to change the dressing or clean the wound. He refused to report the injury to his commanding officer, terrified that a severe leg wound would get him left behind to face the advancing enemy alone. Every step he took pushed the filthy fabric deeper into the raw flesh, creating a perfect, dark breeding ground for aggressive bacteria. The deep, agonizing throb of infection slowly replaced the sharp pain of the initial impact, sending quiet waves of heat radiating up his entire side. We are in the European woods watching a desperate boy seal dirt and bacteria directly into his own bloodstream. Now we move forward to the moment of his capture, where his deep fear of the enemy forces him to make a deadly choice. The desperate retreat finally ended when an American armored division completely surrounded his exhausted, starving unit in a muddy valley. The German officers ordered a mass surrender, and Judel threw his heavy rifle onto the growing pile of weapons with a mixture of relief and absolute dread. As the American infantrymen moved through the lines to search the prisoners, Judel remembered the terrifying radio broadcasts he had listened to back home. The propaganda ministers had explicitly warned that the Americans had no medical supplies for prisoners and routinely executed anyone who required extensive hospital care. Believing this lie completely, Judel made the dangerous decision to act perfectly healthy, putting his full weight on his injured leg to hide the limp. The American soldiers handed out water and cigarettes, moving quickly to process the massive number of captured men. Because Judel was standing straight and wearing a thick winter coat, nobody noticed the dark stain slowly spreading down the inside of his trousers. He survived the initial medical screening by biting the inside of his cheek until it bled, refusing to wince when a guard patted him down. He had successfully fooled the enemy, but in doing so, he guaranteed that his wound would remain sealed in its filthy, rotting bandage. We are at the muddy surrender point where a teenager chooses to hide a lethal infection rather than ask for help. Next, we will follow him on the brutal march toward the coast, where the bacteria inside his leg begins to multiply aggressively. The prisoners were organized into long columns and forced to march for 3 days toward a temporary holding facility near the French coast. This march was absolute torture for Judel, as the friction of his trousers rubbed constantly against the hardening, blood-soaked bandage on his thigh. The original cloth he had tied around his leg was now completely stiff, acting like a piece of rough sandpaper grinding against his raw nerve endings. By the second day, a dark, angry red streak began to travel up his leg toward his hip, a clear biological warning that the infection was entering his bloodstream. His core temperature spiked, leaving him shivering uncontrollably in the middle of the day while cold sweat poured down his face. The other prisoners in his marching column noticed his pale, ghostly complexion, but the brutal reality of captivity kept everyone silent. Nobody had any clean bandages to offer, and speaking up to the guards meant risking a beating or being separated from the group. Judel kept his head down, focusing entirely on the boots of the man walking in front of him, treating every single step as a separate battle. The smell of the rotting tissue was starting to become noticeable, but the general stench of thousands of unwashed, exhausted men provided a temporary cover for his terrible secret. We are on the muddy roads of Europe watching a boy march on a rotting leg. Now, we move to the crowded transport trains, where the infection reaches a critical turning point in the dark. When the marching columns finally reached the railhead, the men were packed tightly into wooden boxcars for the journey to the shipping port. The conditions inside the train were horrific, with 60 men crammed into a space designed for half that number, leaving absolutely no room to sit or lie down. Judel was pressed against the wooden wall of the train, unable to take the pressure off his leg as the train violently swayed and jolted down the tracks. The air inside the boxcar grew stiflingly hot, accelerating the bacterial growth inside his deep muscle wound to a terrifying speed. His fever skyrocketed, sending him into brief periods of delirium where he muttered quietly to himself, completely detached from the reality of the train. It was during this dark, agonizing train ride that the dirty bandage formally fused with his living skin. The dried blood, yellow pus, and dead tissue essentially cemented the ragged cotton directly to the edges of the shrapnel crater. Removing it now would require tearing away the top layer of his skin, exposing the rotting tunnel underneath to the open air. He pressed his hand against his trousers, feeling the rock-hard mass on his thigh, and realized with creeping horror that he was slowly dying from the inside out. We are inside a dark, suffocating boxcar where a temporary bandage becomes a permanent, rotting part of a teenager's body. Next, we follow Judel onto the massive transport ship, where the smell of gangrene finally becomes impossible to ignore. Let us know in the comments where you are watching this from. Are you in the United States, Germany, the United Kingdom, or somewhere else? We would love to know who is keeping these stories alive. The prisoners were eventually herded out of the trains and directly into the deep, dark cargo holds of massive transport ships bound for the United States. In the cramped, multi-tiered canvas bunks, Judel finally had the chance to lie down, but the relief was completely overshadowed by the raging infection. His thigh had swollen to almost twice its normal size, the skin stretching painfully tight over the massive pocket of trapped fluid and pus. The sickeningly sweet smell of necrotic tissue was no longer hidden by the crowd, rising up from his bunk and causing the men around him to cover their faces. A few older soldiers told him he needed to show the wound to the American guards, but Judel threatened to fight anyone who reported him. For 2 agonizing weeks, he lay in the dark hold, riding the violent swells of the Atlantic Ocean while his body fought a losing battle against the bacteria. He stopped eating the rations provided by the ship's crew, his stomach completely rejecting food as the toxins from his leg flooded his system. He spent hours staring at the steel ceiling of the hold, waiting for the infection to finally reach his heart and end the terrifying pain. By the time the ship's massive horn sounded to announce their arrival in America, he was practically a ghost, clinging to life through sheer, stubborn terror. We are deep in the hull of a transport ship crossing the ocean. Next, we arrive on American soil where the 3-week-old secret is finally intercepted by the camp medical staff. This brings us right back to the moment the American medic spots Judel in the intake line and drags him into the bright, sterile hospital tent. The guards hoist the shivering, exhausted boy onto a metal examination table, holding his shoulders down firmly so he cannot thrash and hurt himself further. The head doctor walks over, his face entirely covered by a surgical mask to block the overwhelming stench of the rotting gangrene. He takes a pair of heavy trauma shears and begins to carefully cut away the thick wool trousers, splitting the fabric from the ankle all the way up to the hip. When the fabric falls away, the true horror of the 3-week-old bandage is finally exposed to the bright medical lights. The cloth is completely black, rock-hard, and deeply embedded into a massive, swollen crater of purple and green flesh. Judel props himself up on his elbows, takes one look at the terrifying state of his own leg, and completely loses his mind. He breaks down into violent, hysterical sobbing, screaming in German that they are going to cut his leg off and leave him to die. He tries to kick the doctor away, thrashing against the guards with the desperate, frantic energy of a trapped animal expecting the slaughterhouse. The sheer psychological weight of carrying the secret, combined with the extreme physical agony, shatters his composure entirely on the metal table. We are inside the medical tent, watching an 18-year-old boy suffer a complete psychological breakdown over a rotting wound. Now we will see how the American medical team responds to his terror with an intervention that changes his life. The head doctor realizes immediately that he cannot perform any medical procedures while the patient is completely out of his mind with fear. He steps back from the table, raising his hands in a calm, non-threatening gesture, and orders the guards to loosen their grip on the boy's shoulders. The doctor calls for the camp translator, a bilingual German prisoner who works in the hospital, to urgently explain the situation. The translator rushes to the side of the table, speaking in a low, rapid German voice, telling Judel to breathe and look at the doctor's hands. He explains firmly that there are no bone saws in the room, and that the Americans are preparing to save the leg, not amputate it. Judel shakes his head wildly, tears cutting tracks through the thick layer of dirt on his face, refusing to believe the translator's words. He points a trembling finger at his rotting thigh, crying that the flesh is already dead, and that the radio said Americans always amputate. The doctor listens to the translation, his eyes softening with pity as he realizes the sheer scale of the propaganda this teenager was fed. The doctor steps forward, looks Judel directly in the eye, and has the translator deliver a single, incredibly powerful promise. He promises that he will not remove the leg under any circumstances, but he needs the boy to hold perfectly still so they can kill the infection. We are watching a tense negotiation between a terrified prisoner and a compassionate doctor determined to save his limb. Next, we step back to look at the massive medical reality of battlefield infections to understand exactly how close Judel came to losing his leg. To truly grasp the miracle of what happens next, we have to look at the grim numbers surrounding battlefield infections during the first half of the 20th century. Before the widespread deployment of modern antibiotics, a deep shrapnel wound wrapped in a dirty cloth for 3 weeks was essentially a guaranteed death sentence. During previous global conflicts, minor cuts and puncture wounds routinely led to massive gangrene, forcing field surgeons to amputate millions of limbs just to stop the spread of rot. A bacterial infection deeply embedded in muscle tissue can multiply exponentially, completely overwhelming the human immune system in a matter of days. Judel had survived for 3 weeks entirely by chance, his body fighting a massive war of attrition against the microscopic invaders multiplying in his thigh. When the United States military entered the European theater, they brought with them a revolutionary new weapon that completely changed the mathematics of survival. For the first time in human history, doctors had access to mass-produced antibiotics that could actively hunt down and destroy lethal bacteria inside the bloodstream. If Judel had suffered this exact injury just 10 years earlier, the American doctor would have had absolutely no choice but to amputate the leg at the hip. But in this specific medical tent, in this specific year, the doctor had a completely different tool waiting in a small glass vial. We are looking at the grim statistics of battlefield amputations and the history of gangrene. Now we return to the examination table as the American doctor introduces the miracle drug that will change everything. If you are enjoying this story and want more untold accounts from World War II prisoners of war, make sure to subscribe to the channel. We are bringing you stories that most history books never covered. The doctor signals to a nurse, who immediately brings over a sterile tray holding a large glass syringe filled with a thick, yellowish liquid. Judel tenses up again, his eyes locking onto the needle, completely convinced that they are preparing to inject him with some kind of lethal poison. The translator places a gentle hand on the boy's chest, explaining that the yellow liquid is a highly advanced medicine called penicillin. Judel has never heard the word before, as the drug was tightly controlled and entirely unavailable to standard German infantry units fighting in the forests. He watches in terrified silence as the doctor finds a vein in his arm and slowly pushes the heavy, life-saving antibiotic directly into his bloodstream. The penicillin is just the first step in a brutal, necessary process to completely clean out the massive infection. The drug will hunt down the bacteria in his blood, but the physical rot and the fused, 3-week-old bandage still have to be removed by hand. The doctor prepares a local anesthetic, injecting numbing medication in a wide circle, entirely around the swollen, purple edges of the shrapnel crater. He tells the translator to warn the boy that the next 30 minutes will be incredibly unpleasant, but it is the only way to avoid the surgical saw. Judel grips the metal table once again, nodding slowly, finally deciding to place his blind trust in the hands of the enemy. We are inside the medical tent as the powerful antibiotic enters the teenager's bloodstream. Next, we will witness the agonizing but necessary surgical procedure to scrape away 3 weeks of terrible mistakes. With the local anesthetic taking effect, the doctor picks up a pair of heavy surgical forceps and a sharp scalpel. He carefully slides the blade under the edge of the stiff, blackened cotton, cutting the fibers that have dried into the living skin. Every time the fabric pulls away, it releases a fresh, overwhelming wave of the sweet, rotting smell of gangrenous tissue. Judel squeezes his eyes shut, his breath hitching as he feels the heavy pressure of the doctor's hands working deep inside his thigh. The doctor moves methodically, peeling the bandage away layer by layer, exposing a massive, hollow crater of dead yellow and black muscle. Once the physical cloth is completely removed, the true work of saving the leg begins with a procedure called debridement. The doctor uses a metal curette to physically scrape away all the dead, infected tissue inside the wound, ensuring that only healthy, bleeding muscle is left behind. It is a violent, messy process, but leaving even a tiny piece of necrotic tissue in the hole guarantees the infection will return. Judel bites down hard on a rolled-up towel, groaning in deep, muffled agony as the doctor scrapes the metal tool against his raw flesh. After 40 minutes of grueling work, the crater is completely clean, flushed with sterile saline, and packed tightly with fresh, white gauze soaked in antibacterial powder. We are watching the successful removal of a life-threatening infection through sheer surgical determination. Now we will follow Judel into the quiet recovery ward, where his fever finally breaks and the reality of his survival sets in. Judel is moved to a clean, quiet cot in the intensive recovery ward, his leg elevated and wrapped in pristine white bandages. The combination of the physical trauma and the heavy antibiotics knocks him out completely, sending him into a deep, dreamless sleep for over 14 hours. When he finally opens his eyes the next morning, the crushing, suffocating heat of the fever that plagued him for weeks is entirely gone. He blinks against the bright sunlight streaming through the canvas windows, his mind clearer than it has been since the artillery shell exploded in the forest. He immediately reaches down toward his thigh, his fingers gently brushing against the thick bandages, and realizes with profound shock that his leg is still attached. A nurse walks by, checks his chart, and smiles warmly at him, offering him a metal cup of cold, clean water. He drinks the water greedily, tears silently welling up in his eyes as he processes the absolute miracle of his current situation. The deep, agonizing throb of the rotting tissue has been replaced by a sharp, clean surgical ache that feels like healing instead of dying. He lies back against the pillow, staring at the ceiling, completely overwhelmed by the undeniable proof that the American doctors chose to save him. The terrified boy who broke down on the table has finally realized that the monsters he feared do not actually exist in this camp. We are in the recovery ward watching a boy wake up from a 3-week nightmare with his body intact. Next, we will see how his psychological understanding of the world fundamentally shifts during his slow recovery. Over the next few weeks, Judel remains in the hospital ward, receiving daily doses of penicillin and regular bandage changes. The American doctor visits his cot every morning, checking the healing progress of the deep crater and offering a few words of encouragement through the translator. Every kind gesture, every hot meal, and every careful medical check fundamentally dismantles the heavy psychological programming Judel carried into the camp. He begins to understand that the intense fear which forced him to hide his wound was deliberately manufactured by a desperate regime to keep him fighting. The realization brings a heavy mix of relief and deep anger, knowing he nearly died in a dark boxcar simply because he believed a lie. He starts talking with the other recovering German prisoners in the ward, sharing the story of his hidden wound and his terrifying breakdown on the table. The older soldiers nod knowingly, admitting that they too had expected torture and cruelty when they first raised their hands to surrender. The hospital tent becomes a strange sanctuary of truth, where the boys realize that the brutal war they left behind was built entirely on deception. Judel focuses all his energy on physical therapy, determined to walk out of the medical tent on his own 2 feet to prove the propaganda wrong. We are observing the quiet mental transformation of a prisoner who has been shown compassion instead of cruelty. Now we will follow him as he rejoins the general camp population, walking with a cane instead of a crutch. After nearly 2 months of intense medical care, the massive crater in his thigh has completely filled in with thick, shiny pink scar tissue. Judel is officially discharged from the hospital and assigned to a standard barracks with hundreds of other healthy German prisoners. He walks through the camp gates using a simple wooden cane, a slight limp serving as the only physical reminder of his 3-week ordeal. When his fellow soldiers see him arrive, they are absolutely stunned, having assumed his sudden disappearance at the intake line meant he had been permanently eliminated. He rolls up his trouser leg to show them the massive scar, explaining clearly that the Americans gave him medicine and completely saved his limb. Life in the camp settles into a predictable routine of light work details, adequate food, and quiet evenings spent playing cards or reading letters. Judel no longer avoids the American guards, sometimes nodding respectfully to the medical officers when they pass his workstation near the fences. The terrifying shadow of the rotting bandage is completely gone, replaced by a deep gratitude for the simple, boring safety of life behind the wire. He spends his time focusing on his health, making sure to keep the scar clean and stretched so he will not have a permanent limp when he finally goes home. We are watching a fully healed teenager live a quiet, safe life in an American prison camp. Finally, we look at his return to Europe and the ultimate legacy of the medic who refused to use the saw. When the war finally ends, the massive logistical process of repatriating the prisoners back to a shattered Europe slowly begins. Judel packs his small bag, carrying his wooden cane and a completely altered perspective on the enemies he was taught to hate. The journey back across the ocean is peaceful and calm, standing on the deck of the ship with 2 healthy legs supporting him. He returns to a Germany that is practically unrecognizable, completely reduced to rubble, but he navigates the broken streets with the confidence of a survivor. When he reunites with his family, he does not tell them about the battles or the mud, but about the bright medical tent where a doctor saved his life. Decades later, Judel walks through his hometown with a barely noticeable limp, the massive scar on his thigh hidden beneath his trousers. He often thinks about the terrifying moment the medic cut away the filthy, black bandage, and the absolute panic that consumed him on the table. He knows that his life, his ability to walk, and his eventual family are all the direct result of an American doctor who chose compassion over convenience.